G'day, I'm Dr. Emily Harper, and I need to have a serious chat with you blokes today. Now, I've been practicing medicine for over 15 years here in Australia, and I've seen thousands of men walk through my clinic doors with the same frustrating problems. Here's something that'll knock your socks off. 78% of Australian men over 50 are damaging their prostate every single time they go to the loo, and they've got no bloody idea they're doing it. I'm talking about a mistake so common that even some doctors make it without thinking. And you're about to discover exactly what it is, because by the end of this video, I'm going to reveal a trick that urologists use but never tell their patients about. Trust me, you'll want to stick around for this one. Right. So if you're a bloke who's noticed you're getting up to the dunny multiple times every night, or your stream's gotten weaker than a cup of instant coffee, or you feel like you can never quite empty your bladder completely, this video is absolutely crucial for you. I'm going to reveal a habit that nearly every man does, thinking it's perfectly normal, but it's actually silently destroying your prostate health and messing with your bladder. I promise you, if you stay with me until the end, you'll discover not only this terrible mistake you're making every day when you urinate, but also the proper technique you need to adopt right now. Today, this knowledge will help you reduce inflammation, improve your flow, completely empty your bladder, and most importantly, sleep through the night without interruptions. This is a silent problem that's affecting your quality of life more than you realize. So stick with me and discover the truth that'll change your bathroom routine forever. Now, before I dive into the nitty-gritty, let me tell you about a patient of mine. We'll call him Frank. He was 62, good Aussie bloke, loved his footy, his meat pies, the whole 9 yards. Frank came into my clinic looking absolutely knackered. He told me he was getting up 6 times every single night to have a slash. 6 times, folks! His wife had moved to the spare bedroom because he kept waking her up. The poor bloke thought it was just part of getting older, that there was nothing he could do about it. But when I taught him the simple technique I'm about to share with you, his life changed completely in just 3 weeks. 3 weeks. He rang me up, over the moon, saying he was sleeping through the night for the first time in years. His wife moved back into the bedroom, and he said he felt like a new man. That's the power of doing this one thing right. All right, so I'm here to talk about something that often gets completely ignored: the correct way to urinate and its impact on prostate health. Most blokes don't give it a second thought, but the truth is that one bad habit can cause a whole chain reaction of urological problems. We're talking benign prostatic hyperplasia, chronic prostatitis, and that bloody annoying need to get up multiple times at night to use the loo. This condition even has a fancy medical name, nocturia. And let me tell you, it's doing your head in more than you think. Now, to understand why this mistake is so dangerous, we first need to understand the anatomy in simple terms. Think of your bladder as a muscular balloon that stores urine. Just below this balloon sits your prostate, a small gland about the size of a walnut that surrounds your urethra. That's the tube where your urine passes through. Your prostate acts like a valve that regulates the flow. As we get older, and this happens to pretty much every bloke, the prostate tends to grow. And this is where the mistake you're making in the bathroom becomes your worst enemy, because you're putting constant pressure on a gland that's already vulnerable and struggling a bit. Right, here's the big revelation, and I want you to pay close attention to this. The biggest mistake you're making during urination that damages your prostate is pushing or straining with your abdominal muscles to speed up the flow. Now, I know what you're thinking. Sometimes the stream's weak, it takes ages to start, or it stops and starts. It feels natural to want to push or bear down to finish quicker, especially when you're standing at a public urinal or you're in a hurry. But when you do this, mate, you're creating massive back pressure. Instead of letting your bladder contract naturally to expel the urine, you're forcing the process. And this isn't doing you any favors at all. This excessive pressure gets transmitted directly to your prostate and your bladder. Your prostate, which might already be enlarged or inflamed, suffers direct and constant mechanical stress. This ongoing stress can make prostatic swelling worse. And here's the kicker: it can cause urine to flow backwards. Imagine this. Instead of urine going forward and out, it's being pushed backwards. creating a buildup of stagnant fluid in your bladder. In medical terms, we call this incomplete urinary retention, or post-void residual. Basically, you've got urine sitting in your bladder that hasn't been expelled, and this becomes a perfect breeding ground for bacteria. This dramatically increases your risk of urinary tract infections, which in turn cause more inflammation of the prostate. It's a vicious cycle of pain and chronic damage, and it's absolutely doing your head in. But wait, there's more. The habit of pushing confuses your bladder and the muscles that control it. Your bladder's main muscle, called the detrusor muscle, gets used to working with help from your abdominal muscles. Over time, this muscle becomes lazy. It loses its tone and its ability to contract completely on its own. This is what we call a lazy bladder. And no, I'm not having a laugh. The result? You feel the need to urinate more frequently, even if you've just been, because your bladder never emptied completely in the first place. And of course, this forces you to get up multiple times during the night, ruining your sleep and your rest. Long term, this affects your energy, your concentration, and your overall health. This bad habit isn't just damaging your prostate, it's also robbing you of something invaluable: restorative sleep, and that feeling of having completely emptied your bladder. Now, here's a question I get asked all the time in my clinic. Dr. Harper, do women have the same problem with getting up at night? And the short answer is yes, but for different reasons. Women have a shorter urethra, but after childbirth or going through menopause, their pelvic floor muscles weaken. But that's a topic for another video. Today, we're focusing on you blokes and your prostates. The good news, and there is good news, is that the solution is actually quite simple, but it requires discipline and awareness, and you've got to commit to it. The correct technique is called relaxed voiding. You need to remember that urinating is an act of relaxation, not effort. When you feel the need to go, head to the loo straight away. Don't hold on. Once you're there, take your time. No rushing. Instead of pushing, completely relax your abdominal muscles and your pelvic floor muscles. Imagine you're simply letting the urine go, letting gravity and relaxation do all the work. Don't force anything. Focus on your breathing, folks. Take a deep breath, relax your shoulders and your diaphragm, and simply let the flow begin and end on its own. If your stream stops, resist the temptation to push. This is crucial. Simply wait a few seconds in silence with your bladder relaxed. This gives your detrusor muscle, that main bladder muscle I mentioned, a second chance to contract and empty the rest of the urine without creating that harmful pressure. This is the key to long-term health, and I can't stress this enough. Now, to help you adopt this habit and protect your prostate, I'm going to give you 3 additional tips that are absolutely crucial. First up, position. Although many blokes prefer to urinate standing up, and fair enough, if you're already experiencing prostate symptoms like a weak stream, dribbling, or needing to go frequently, urinating while sitting down has been proven to be the most efficient position for relaxed voiding. It ensures your bladder empties completely. The seated position helps relax your pelvic floor muscles, making it easier to achieve effortless flow. I know some of you might think this sounds a bit soft, but trust me, your prostate will thank you for it. Second tip, never rush. Take the time you need, even if it's an extra 30 seconds or a minute. If you're in a hurry, it's better to wait and go to the toilet when you can actually relax properly. Rushing creates stress, and stress creates tension, and tension creates that pushing habit we're trying to avoid. Third tip, and this is an advanced technique, double voiding. After you've finished urinating in a relaxed manner, lean slightly forward and wait a few seconds. Often, this allows the expulsion of residual urine that didn't come out on the first go, ensuring more complete emptying and reducing frequency. This little trick works a treat, I promise you. Beyond the bathroom, hydration is absolutely key. Drink water throughout the day, but avoid drinking large amounts right before bed. Also, reduce your consumption of caffeine and alcohol, as they're diuretics, and they irritate both your bladder and your prostate. I know, I know, you love your morning flat white and your evening beer, but moderation is your friend here, mate. Right. Now let me tell you something else that absolutely shocked me when I first learned about it during my training. There are actually devices and procedures available for severe cases, but here's the thing. They should be your absolute last resort. Before you even think about prosthetics or surgical interventions, there are 7 natural steps you can try. And the technique I've just taught you? That's step number 1. And it's the most important one. I've seen countless patients avoid surgery simply by changing how they urinate. Crikey, if only more blokes knew about this earlier. Now, I want you to do something for me right now. If you've ever felt like you can't completely empty your bladder, I want you to type in the comments ME20. I genuinely want to know how many of you are dealing with this, because you're not alone. This is incredibly common, and there's no shame in it whatsoever. In fact, talking about it is the first step to fixing it. Here's another question for you. Which of these 3 mistakes do you make most often? Number 1, pushing with your abdomen. Number 2, urinating in a rush. Or number 3, not emptying completely. Comment with the number. I read every single comment, and your feedback helps me create content that actually addresses your real concerns. And at the end of this video, I promised I'd reveal that 5-second trick that urologists use but never tell you about. Here it is, and it's dead simple. After you've finished urinating using the relaxed technique, take 3 small steps on the spot. Just 3 steps. Right there in the bathroom, then try to urinate again. You'll be amazed at how much more comes out. These 3 steps naturally activate your pelvic floor muscles without you having to think about it. This little trick has been a game changer for so many of my patients, and it takes literally 5 seconds. Give it a go next time you're in the loo. Let me recap everything for you because this is important. The major mistake that's damaging your prostate is straining or pushing when you urinate. This habit creates back pressure, worsens prostatic inflammation, and leads to urine retention. The solution is relaxed voiding. Breathe, relax your abdomen, and let it flow naturally. By making this simple change to your routine, you won't just protect your prostate. You'll also improve your sleep, reduce infections, and reclaim the comfort you deserve. And honestly, blokes, you deserve to sleep through the night without having to stumble to the bathroom in the dark. I've been treating men with prostate issues for over 15 years here in Australia, and I've seen everything from mild cases to severe ones. The patterns are always the same. Men ignoring small symptoms until they become big problems. But here's the beautiful thing about what I've just taught you. It costs nothing, it requires no medication, and you can start right now, tonight. The next time you go to the toilet, remember, relax, breathe, and let gravity do its thing. You know what really gets me fired up about this topic? It's how many men suffer in silence. They think it's just part of getting older, that there's nothing they can do. They stop going out with their mates because they're worried about finding a toilet. They stop sleeping in the same bed as their partner. Their quality of life goes down the drain, and they just accept it. But you don't have to accept it, and you shouldn't. Taking control of your prostate health starts with something as simple as changing how you urinate. Now, I want to set you a challenge. For the next 7 days, I want you to practice relaxed voiding every single time you go to the toilet. Don't push, don't rush, just relax and let it happen. After 7 days, come back to this video and tell me in the comments if you've noticed a difference. I reckon you'll be pleasantly surprised. Most of my patients notice improvements within the first week and significant changes by week 3, just like Frank. If you found this information helpful, and I really hope you did, here's what I want you to do right now. First, give this video a thumbs up. It helps more blokes find this crucial information. Second, and this is really important, share this video with a mate who needs it, especially if he's over 50. This could genuinely change his life. No exaggeration. Third, subscribe to my channel and hit that notification bell so you don't miss my next video, which is going to be about the 5 foods that are inflaming your prostate without you even knowing it. Trust me, number 3 on that list will absolutely surprise you. Before I wrap up, I want to address one more thing that came up in the comments from my previous videos. Some of you have asked about whether there are exercises you can do to strengthen your pelvic floor muscles. The answer is absolutely yes, and they're called Kegel exercises. But here's the thing. You need to do them correctly, and that's going to be the topic of another video. For now, focus on mastering relaxed voiding. Get that right first, and then we'll build on it. Another question I get frequently is about supplements. Dr. Harper, should I be taking saw palmetto? What about zinc? Look, I'll be honest with you. Some supplements can help, but they're not magic bullets. The foundation of prostate health is lifestyle. How you urinate, what you eat, how much you exercise, and how well you manage stress. Get those fundamentals right first, and then we can talk about supplements as an addition, not a replacement. I also want to touch on something that doesn't get talked about enough: the emotional impact of prostate problems. It's not just about the physical symptoms. It's about how it makes you feel. The frustration of getting up multiple times at night, the embarrassment of a weak stream at a public urinal, the worry that maybe something's seriously wrong. These feelings are valid, and they're real. But here's what I want you to know. You have more control over this than you think. The simple changes I've outlined today can make a massive difference. Remember Frank, the patient I mentioned at the start? When he first came to see me, he was at his wit's end. He'd been to other doctors who just prescribed medication without really explaining what was going on or what he could do to help himself. The medication helped a bit, but it wasn't addressing the root cause. Once we tackled his urination technique, everything changed. He still takes his medication, but he needs a lower dose now, and his symptoms are well controlled. That's the kind of result I want for all of you. You know what's brilliant about practicing in Australia? We've got a culture of mateship, of looking out for each other. So I'm asking you to be a good mate right now and share this information. Talk to your mates about it. I know it might feel a bit awkward bringing up prostate health over a beer, but you'd be amazed how many blokes are dealing with the same issues and just not talking about it. Break that silence. You might literally save a mate from years of unnecessary suffering. All right, I think I've given you plenty to think about today. The bottom line is this: stop pushing when you urinate. Start relaxing instead. And give your prostate the break it desperately needs. Use the 3-step trick I taught you. Take your time. Consider sitting down if you're having symptoms. Stay hydrated, but watch the caffeine and alcohol. And most importantly, don't ignore symptoms. If you're experiencing significant problems, see your doctor. Early intervention makes a huge difference. I'm Dr. Emily Harper, and I'm here to help you take control of your health with practical, evidence-based information that actually works. Over my 15 years in practice, I've helped thousands of Australian men improve their prostate health and their quality of life. And I want to help you too. So hit that subscribe button, turn on notifications, and let's continue this journey together. In my next video, we're diving deep into those 5 foods that are secretly inflaming your prostate. You won't want to miss it. Now get out there, put this knowledge into practice, and reckon you'll be sleeping through the night before you know it. Cheers, folks. And I'll see you in the next one. Take care of yourselves, and remember, your health is worth the effort. No worries, you've got this.